I'm Mike.
I'm Rob.
And welcome to another episode of Unmasking America. Today we're going to try to put a documentary feel on the show. And the camera guy is going to be asking some questions.
Hi, I'm Director Alex, the director of the show, rather. I'm going to be asking them some questions on healthcare and why it should be free. Okay, so guys, what are your opinions on what I just said?
First of all, this has been documented many times and said many times, over and over again, and this is a subject that's been
It's been done to death.
Yeah.
Pretty much, yeah.
But my opinion is, if you're working into the system, then you should have health care. And there should be no $2,000 deductible.
Fully covered medical health care. Fully covered. That means everything is covered from medications to ambulance rides to going to the hospital, ER visits. Everything should be free. Because we get taxed a lot. And that money should be going for that reason. That's my opinion on it.
Now, why do you think they are taking stuff like that away from us? I mean, they're already taking our money away for taxes. Why do you think that they're also taking this away from us?
Well, it's pretty simple, as in the healthcare companies are pretty greedy. They don't want to pay. And they've said that they've already paid enough and that they're suffering, which I highly doubt that they are.
But the thing is, I don't see why we have to pay a $2,000 deductible. I don't see why we have to pay co-pays every time we go. If we pay already medical insurance and pay taxes, where is the money going? I don't get where it's going.
How many times do you get sick a year?
Very rare. I mean, maybe once or twice a year, a cold, stomach ache, but it's nothing.
Nothing that you have to really see the doctor over.
No.
And once in a while you'll go for a cold because you want some antibiotics.
Right, then I think it's complete bullshit.
But the fact that you're paying $2,000 means they're not paying anything.
Right. I think it's complete bullshit that if you don't have medical care, that you get arrested or you get a fine. Like, how the hell does that work? I mean, you threaten to fine people, like what? It was $800 if you don't have medical insurance. What kind of bullshit is that? You know, that's like blackmail. You know,
it is blackmail.
You know, like, what if you don't have the money to cover? Oh, Obamacare is free, everything else. But then you have a cutoff time. Why do you have to have a cutoff time? There shouldn't be a cutoff time. You should just be able to walk down there and get your ass covered. That's my take on it. You know.
Now, do you mind if I ask this question? It's a little bit of a personal question, but do any of your jobs offer health care?
They do. They do offer health care. But yet again, this is something we have to pay out of pocket from our paychecks every week. So we have to have a copay. I don't think you should have a copay. If you're already paying for insurance, everything should be covered. Everything should be free. All of it. There should be no reason why we have to have a copay if you're already paying for it.
I never understood the idea of a copay. I mean, why?
Well, I think it's because, like you said, they're just very greedy. They think that you owe them for everything, and that's not always the case.
They're there for our benefit because we're paying into the system.
And they've been doing this probably ever since you've been alive, both of you.
Right, and then we're paying into Medicare as well, for the older folk, people who are ready to retire. Our generation is paying for them to retire, and then the generation that's going to be after us is going to pay for our retirement. And it's like, we're paying state tax, we're paying federal tax, we're paying Medicare, we're paying insurance. Like, before you know it, it's like, how much money, how are you going to bring anything home?
You make over $500, you look at your check, and you come home with $350-something.
It's bullshit.
So
theft.
So basically, like the old saying is, it's like taking candy from a baby.
Pretty much, because most people aren't going to question it. They're just going to say that's what it is.
And accept it.
Yeah, turn a blind eye.
Like a friend of mine, he tends to believe, the government should be allowed to take from you, and he believes that we can't build from the ground up on our own without the government's help, and that's not true. That's bull crap.
What do you think's going to happen when he can't pay his loans on his house?
They take it away.
They're going to be knocking on his door.
And I remember from the first episode, or the introduction episode rather,
right.
You went in that you don't think we really need a government. And I think that in this case, you are absolutely correct, Rob, because they just seem to steal from us. And it's kind of funny that they call, like, foreigners or people, like, anywhere call us the land of the free, when really we should be called the land of the expensive. Which I know it's a funny word to say, but...
Oh, we also live in Connecticut, man, so
it's
we're like the tax capital of the world. We get taxed for everything. I mean, I'm surprised we don't get taxed to breathe the air here, you know?
Like,
They wanted to give us a mileage tax.
I think that it's funny that why aren't we following what other countries like Europe, wherever...
Right, universal healthcare. Why does Canada have universal healthcare?
Because we have greedy leaders
And does it work for
greedy
them?
corporations.
And it works for Canada, though, doesn't it? Doesn't it work?
It works for them.
Right.
The other thing that's funny, too, and I know this isn't medical, but it's even for free college. Like, they have free college all universal. We don't even have that. And it's like, not only should we have free medical, but we should have free college as well, because what if we don't have people that, like, what if there's someone that's poor out there who wants to be a doctor and doesn't get that chance to become one? And also, don't you think in your head, too, that doctors even agree, why isn't medical free? I mean, I know that I kind of segued from there, but it all goes hand in hand, you know?
Right.
Well, I don't know what the doctors are thinking, but, I mean, I definitely know what the medical corporations are thinking.
Well, the thing is that I think I know what the doctors are thinking. Some of them are very greedy, but there's doctors out there who also want to help, and they aren't getting enough patients, because they're afraid to go to the hospital because they're getting billed till there's no tomorrow, you know?
Right.
What were you going to say? Sorry, we kind of cut you off there.
But yeah, that's my take on it. It's like, if you're putting all this money from your paycheck into taxes, into Medicare, into federal, state, whatever,
shouldn't have to pay
you
again.
shouldn't have to pay again.
Twice.
It's like, you got to realize that all this money should be going to what it's supposed to be going to. You know, why are we paying for shit that we don't even want? Like, why are we doing this?
I think they're putting
It's not why, it's why are they doing this to us?
I think they're putting all this money towards, like, remodeling buildings, making roads more paved, and it's like, we don't need that stuff. We don't need any more rebuilding or anything. What we need to do is rebuild this nation and have people come together, and we shouldn't just let this happen. We shouldn't be just sitting. We should have people get more involved with getting free medical, because it just doesn't seem like Obamacare is really cutting it, you know?
A perfect example, actually, of money going into the wrong places is in New Britain.
Right.
They literally spent, how much was it? Like millions of dollars. I think it was close to $1 million to remodel the sidewalks and just put bricks in and remodel a park that was already there, instead of actually putting the money into the school system or somewhere where it should have gone, or even somewhere towards helping the Access Healthcare place that they have in New Britain.
But there is one thing they did put their money towards, which was a very smart thing, was the fast track, or the Connecticut Transit. People do need to get around.
That's
they did
true.
right there.
That's a good investment.
That was a very good
investment. I'm not going to argue with that.
But
those bricks do absolutely nothing. They don't even
No.
make the place look fancier.
No.
Nobody pays attention
Absolutely.
to that. They just walk on them.
right.
Nobody's like, oh my God, look at this beautiful brickwork. Look, you know, this is like a work of art here. It's
Well,
just some
basically
bricks.
Getting back on track, the whole idea is when we put our money into the system, we expect the money to go to where it's supposed to go. And that's not what's happening.
That's absolutely right.
But this is just a small segment, so we are going to end the segment, and I want you to share, I want you to like, I want you to subscribe, I want you to dislike, I want you to do whatever you need to do. Just don't forget to share.
Thank you for watching. Have a great day.